most famous physical therapist on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heneick, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course,
And
Bob.
today we're going to talk about best sleeping postures for neck pain, pinched nerves, and arm pain.
Sure.
Now, if you feel like you're having back pain and problems like that, don't worry, we're going to do a video on that too.
You bet.
So this
All
is
right.
just more, we're going to concentrate on the
Uppers.
upper quadrant here. So the first thing, Brad, when you're sleeping, no matter what position you're sleeping, if you're sleeping on your back or your side, you always want to make sure everything's lined up really well.
We call
So-
neutral position.
Right, exactly. So my ears are kind of up over my shoulder.
Right.
If I'm laying on my back and I have a thick pillow,
Yep.
I'm going to be like this,
Sure.
which is not good.
Sure.
If I'm laying on my side and I have a thin pillow, I'm going to be like this. So I want to be right in the middle.
Right. Keep
So-
it in that neutral position.
And that's where I think this pillow comes into handy, a cervical pillow. The problem with cervical pillows, Brad, though, is it's very difficult to find one that you like. The reason I have this one here today is my daughter bought one, this was it, and she hated this one.
Yeah.
And then she got another one and she loves it.
Sure.
So,
Because different
manufacturers,
thickness.
yeah, softness,
Yeah.
and I don't know how to solve that problem beyond ordering it and then I don't know if you're allowed to send them back.
Right. Trial and error, and it's an issue. But when you get that right one, you really like it.
Right. And the thing about these is you can try to simulate it.
Yep.
I mean, you can put a pillow and actually take a rolled towel and different thicknesses and different softness and slide it in the pillow. And the idea behind this, Brad, is that when you're, well, I was going to show on this one first, Brad, because I think you can see it better on this.
You're confusing me, Bob.
Yeah, when you're laying back here like this, and my head goes into the valley here,
Right here.
you can see how my neck lines up pretty well with my shoulders now.
Right. If we're
My
looking here,
ears.
and then the thicker spot here goes up to support the neck and
Yeah.
allows the head down into the valley of the pillow.
Right, so you're getting some support for the neck here. And then conversely, when I roll on my side, I can flip this around right
Sure.
right, Brad? So it's a little thicker, and so I can stay up and keep my head like this more level as
Right.
opposed to going down like this.
Right. So if you can see, want to move your hand, Bob, this is about maybe 4 inches here, and this is about 3 inches here. So it's designed like that to have different levels so you can work with it.
So if you're not if you're not going to buy a special pillow, though, just go ahead and use a thinner pillow if you're sleeping on your back, or and then when you sleep on your side, you can double up the pillow.
Sure.
Or you can put two pillows on there.
So going like that
Right.
can be a nice way to do it.
Don't use your arm up in here. This is hard on your arm and shoulder and hard on the nerves coming out of the neck. So you don't want to do that.
Right.
You want to stay off that.
Did you want to talk about this
Yeah,
option?
yeah, sounds good,
Yeah,
Brad.
they actually, like anything else, they make rolls. They call it cervical rolls. This is the McKenzie cervical roll, and we're big fans of McKenzie. And with this, just like with that towel roll in here, you'll definitely find this more comfortable
Yeah, because
than
this
a
is
towel
nice
roll.
and soft, and it's really a good
Yep.
consistency.
And you're going to put that in there. And a lot of times, you can do it outside the pillow, but this way you can see where we're going with
Yeah,
it.
and that is actually very comfortable,
Yep,
Brad.
yep.
I could see actually doing that. I'm not one that does do that, but I'm going to give you another little hint, and this is one I'm sure you'll not have seen anywhere. This is by Brian Mulligan, physical therapist out of New Zealand. You're going to take a pillowcase, and this is if you're having a lot of neck pain and you're trying to get things to calm down. You're going to fold the pillowcase lengthwise like
Yep.
this, and then fold it again. So into a third.
So it's about 3 inches or so across.
Yep. And then what you're going to do is going to go ahead and wrap it around your neck, all the way around, and then you could tape it in place, or I always hate to use a safety pin. What if that comes loose in the middle of the night?
Oh, Bob, just get us.
Anyway, so it's on here, and this is going to prevent your neck from going into the extremes of range of motion, which might give you pain.
Right.
Which kind of leads me to the next thing. By the way, I don't like people sleeping on their stomach, because when they're sleeping on their stomach, what do? they have their head turned all the way one direction or all the way another
Right.
direction. And the joints of the neck don't like to be on their extreme.
Right.
You know, and that's every joint.
Right.
The shoulder doesn't like to be in this position for a long period of time. It likes to
Exactly.
be in the mid-range
Right.
here. So this is something you may try if you're in the throes of neck pain.
This is one of those things that looks like, what's that going to do? But it's one of those little things that makes
You'd be surprised.
Yep.
Patients are often surprised how well it works.
Right.
So
this
I'll
is like
give it a
one
shot.
of those old home remedies where you wrap the towel around your neck, and they can really surprise you on how well things work. That costs like nothing.
Give it a try.
Yep.
All right, it doesn't cost you anything. So the other thing we just talked about, don't sleep on your stomach, and people go, well, I end up on my stomach. Well,
Right.
there's two things you can try. One time I heard an orthopedic doctor talking about wear a baseball cap to bed, and when you try to sleep on your stomach, it'll stop you, obviously. Of course, probably just flip it around in the middle of the night.
Right. Maybe you could duct tape it to your head.
There we go. Yeah, that'd be a good thing.
I like duct tape.
Otherwise, you take an old T-shirt, and you're going to actually just duct tape this ball right to your chest, and that's certainly going to stop you from, because as soon as you roll over onto your chest, you're going to get the ball reminding you to get off of it.
Some people have, they're laying on their back, and actually, go ahead, lay down, Bob. And just simply surround yourself with pillows.
Right. Yep.
And when you're sleeping, you start to roll over. You'll feel those pillows, and then oh yeah, I'm not supposed to roll over. Those big, long body pillows work good for that.
Oh, actually,
too.
Brad, and the reason that's even better than, especially if you're having pain going from your neck down your arm, this is the thing I tell people all the time, keep that arm supported as much as you can. So when you're laying on your back, I have them do this type of thing. I have them support the arm this way or like this.
Right.
It makes a huge difference.
Sure.
I mean, you'd be shocked. I also this is not talking about best sleeping position, but even during the day, I have them put a pillow here.
Exactly. Oh, that makes a big difference. I'll have someone will put a cold pack on their shoulder, and they'll be on the armrest of the chair, and then I'll put a pillow under there, and a smile comes to their face.
Well, the worst yet is if they let it hang.
Yeah.
Because the muscles are activating when it's hanging.
Right, without you thinking about it.
Yeah, without you knowing about it. So.
Oh, one more, Bob, laying down.
Sure.
Okay, now I get to hit you. No, I'm just kidding. Lay on your side.
This side?
Yep. This is a really nice, if you're a side sleeper, get a pillow right there, and that can make all the difference in the world between sleeping and waking up with a sore shoulder.
Yep, yeah, absolutely. Or you can have two, like you said, the body pillows are nice.
Yep.
Or you can have two pillows here even.
Right.
These are things you're going to have to experiment with to see what works for you.
Right.
Because it can make a huge difference in what works. When you're laying on your side, I would try to stay off the point of the shoulder, which is right on the shoulder like this. If you can just move back a little bit like this, now you're on the shoulder blade itself,
right.
And that can tolerate it more than this.
Yep.
So, and how do you do that? And I just had a patient, and she does this. She just takes a pillow like this and kind of comes back like that. It holds her enough to stop her from rolling back, but it's not, and it keeps you from going this way too.
Why don't you stay right there one spot?
Sure.
One thing I do with patients when I have them lay on their side on the plinth, and it's like pull your shoulder forward, they don't get it. And I'll come up to them and I'll take this arm and I'll just gently go like this. And then, oh, I see what you mean. And then you get that shoulder there. It's more relaxed, but you're still on your side enough to, keep you happy. And, if you're a habitual side sleeper, that is.
This is one that I do, Brad, and you looked at me like you thought I was crazy.
I did.
But because I'm tall, I tend to get a little rounded up in here. And I actually like to sleep with a roll towel right below my shoulder blades like this.
And that makes sense for posture and whatnot. I'm thinking, but nobody sleeps like that, but he does.
I do.
So
I
this
sleep
is an
like this.
option.
This is what I do. I sleep on my back and like this. And I love this. This really lines me up really well.
Sure. Yeah, I can see that.
And you can go, a smaller towel if it's too much for you. And I used to sometimes even put pillows under both arms.
Sure.
My wife used to just give me a hard time about that. But now I'm actually pretty comfortable like this even a lot of times.
She could just put her arm under there if you didn't have a towel.
There's actually a syndrome called honeymoon syndrome,
Yeah.
where someone falls asleep on your arm and they get a palsy. I mean, the nerve actually gets killed and
Oh,
dies.
really?
Yeah, I mean, it comes back usually.
Yeah.
But it's called honeymoon syndrome, where your spouse falls asleep on your arm and you get numb and tingling.
I
And
wonder why my wife's been doing it lately. She must have heard about that.
And that's the other thing. We don't want you sleeping with your arms overhead if you're on your
Right.
back, or on your stomach, again, which we don't even want you to do, because you're putting stress on those nerves. The brachial plexus basically is getting impinged upon.
And it cuts off the circulation. It can. If I sleep on my stomach like this, my arms literally go completely numb.
Yeah, same with me.
It's kind of fun, but I don't.
I've had them both go numb, and one time I was trying to get the alarm clock, and I'm going like this.
Yeah. We should get a video of that.
Yeah, well, that would be funny. That'd be worthwhile. Any other hints, Brad? I think that covers pretty much the upper body, doesn't it?
About what?
About
Sleeping on your side, yeah.
You forgot what we were even talking about. Thanks, everybody, for watching.
Running on for a while. What time do we have there, Lonnie?
All right.
Take care.
Thanks for watching.